Hey guys, welcome back to the channel. Hope you guys are doing good. Lately, we've been hearing a lot about a respiratory virus making the rounds, hMPV. Now, before you panic, let's break down what hMPV is, who's at risk, and most importantly, how to protect yourself and your loved ones. So without wasting any more time, let's get started. hMPV, also known as human metapneumovirus, is a common respiratory virus that causes an upper respiratory infection like a cold. The upper respiratory tract includes the nasal cavity, pharynx, and the larynx. hMPV is a seasonal disease that usually occurs in the winter and early spring. Coming to our first question, who is at risk? hMPV can cause upper and lower respiratory disease in patients of all ages. However, it is most common in young children and the elderly, in whom it is more likely to develop bronchiolitis, bronchitis, or pneumonia. This is also true for people with weakened immune systems, including patients undergoing chemotherapy or post-organ transplant. So, how does this virus spread? hMPV is most likely spread from an infected person to others through secretions from coughing and sneezing, close personal contact such as touching or shaking hands, touching objects or surfaces that have the viruses on them, then touching the mouth, nose, or eyes. Symptoms of the virus are similar to cold, which include cough, runny nose or nasal congestion, sore throat, and fever. Coming to the diagnosis of this virus. Infection with hMPV can be confirmed usually by direct detection of viral genome by nucleic acid amplification test and direct detection of viral antigens in respiratory secretions using immunofluorescence or enzyme immunoassay. Now coming to the third and the most important question for us. How to protect yourself and others. You can prevent the spread of hMPV and other respiratory viruses by following these simple steps. Wash your hands often with soap and water for at least 20 seconds as recommended by the CDC. Avoid touching your eyes, nose or mouth with unwashed hands. And avoid close contact with people who are sick. Lastly, about the treatment. Currently, there is no specific antiviral therapy to treat hMPV and no vaccine to prevent hMPV. Medical care is supportive. Most cases resolve without treatment after 2 to 5 days. The supportive management includes rest, drinking plenty of fluids, acetaminophen or ibuprofen, and supplemental oxygen and fluids if needed. Now, I know this information can be a little overwhelming, especially after the COVID pandemic. But remember, staying informed is the key. Stay safe and stay healthy. So that is it for this video guys. Don't forget to subscribe the channel and follow us on Instagram. Links in the description.